All right, John. Kevin here. I'm going to show you how to use this knee brace to stabilize your leg following your quadricep injury. So the best way to put this thing on, we've got it fitted for you. So I'm going to show you how to put it on. You can put it on a table or on your bed. You're going to lay it out like this, and then you're going to set your leg on top. So you got it right underneath your leg here. Couple important things. We're going to strap these on. You can start from the top and just hook these clips in. You'll hear them click. Make sure the padding is right there guarding your skin. All the way down the line. And when you're setting this up and putting it on, the most important thing is that these pads line up with right where your knee is going to be bending. So you'll see those line up nicely. We don't want them to be too high or too low. They line up with these bumps that stick out on your bone near your knee there. So right where it bends, that's where you want these to line up. I'm going to show you how to set these. So these are going to tell you your range of motion. So you have an extension and a flexion. We want the extension to be at 0. And we want your flexion to be at 90. So there's a little black button there. You can slide these up. That would be flexion at 30, 40, 70. We're going to keep it at 90. Make sure it's not sliding around. Your extension is going to be at 0. And then you're also going to have that on the other side. So they need to be identical. Flexion 90, that's locked in. Extension 0, that's locked in. So when you're not up and moving around, this can be, you can passively move this. We don't want any active movement, but you can passively move. When you are up and moving, this needs to be locked in 0 degrees of extension. So that's our other setting here. Again, black button, you're going to push down. We're going to line that up with 0. And push it in and let go. Okay, that's locked in. We're going to do the same thing on the other side. Line it up with 0, push it in, let go. That's locked in. Okay, now I can't bend my leg at all. So that's exactly what you want anytime you're going to be up and moving around. Make sure those are locked. Give it a little test. You're good to go. Then you can get up. And you're going to be walking around with this locked in 0 degrees of extension anytime you're up and moving. You'll get used to it. It's a little awkward. But with some time and repetition, it'll be no problem for you. To take this off, we're going to reverse those steps. So we're going to come back to the table or to a bed. You're going to get your leg nice and flat. We would only take this off to kind of air your leg out. If you notice there's irritation, we definitely want to check on the brace and make sure it's fitting properly. You're going to undo all the clips. You're going to lay it flat. And when it's not on, again, you don't want any active knee extension. You cannot be extending your knee. That is a big no-no. Passively, you can do passive range of motion up to 90 degrees. When you do take it off, it's important to check your skin. So, look for any redness. Anywhere the brace was touching, we want to see if there's a red mark. You're going to check your skin by pressing on it. When you press on the skin, you hold your finger there for 5 seconds, let go. It should turn white. That's good. The color should come back within 3 seconds. That's also good. What's not good is if it's red and we press and it stays red. That could be a problem. We want to hang tight for, say, 15 minutes. Try again. If it comes back and it turns white, that's good. We might need to check the fit of your device. If it doesn't turn white, if I press on my red spot and it stays red, that's a cause for concern. You're going to want to give me a call, come see me, or we're going to get you into the doctor, whoever you can see first. In terms of cleaning your device and taking care of it, you want to keep an eye on all the clips and the different joints on the device. Make sure everything is intact, and then clean this thing off. Wipe it down with Lysol or Clorox, something to sterilize it and keep it keep good hygiene for your skin and for the device. That is, I think, everything for you. If you have any questions, let me know.